this will leave a lasting impression on us in terms of integrating pandemic preparedness into emergency preparedness as a whole. On the one hand, it's pushed our capacity to the limit. And then on the other hand, it's really shown us the strengths that we have in our system as well. Just the ability to come together, the ability to create surge capacity, the ability that people have in their day-to-day jobs to shift their attention to this. Faculty members from across the health sciences faculty at Douglas College, which is one of the largest health sciences faculties in BC, really want to lend a helping hand. Clinical experts who are used to teaching in the field, have a lot of practical experience. And we thought to ourselves, what can we do? How can we really support what's happening on the front lines? We prepared a webinar for community health centers across Canada. We could look to the future towards potentially things like, when is it best to wear what kind of mask? What happens if we run out of gowns? What is the next best thing after gowns? Those kinds of questions that perhaps aren't easy to just look up from a public health authority. Let us know, what are the practice questions that are arising? What possible knowledge translation tools could be created, whether it be webinars or decision support tools. And we're happy to go out and first find the answer from an evidence-informed perspective, and then put that together in a way that makes sense for those who are asking. Throughout history, we've known that epidemics and pandemics come and then, repeat themselves. It's very likely that there will be a next time. In BC, at least, we're really good about emergency preparedness in general. We think a lot about, what would happen in an earthquake, other kinds of disasters. But it's interesting, in a lot of the community work that I do, in a lot of the different agencies that I speak to, agencies that might have a committee for what happens in an earthquake, what happens in a flood, all these other possible problems, hadn't considered the idea of a pandemic as a potential thing to contend with. And so I think that this will leave a lasting impression on us in terms of integrating pandemic preparedness into emergency preparedness as a whole.